Hi everyone, I am Ahmed Gad from P.E.T.C with you. In this video, I'll talk about OTC for OTIC Dental Ophthalmic Agents products. Now we will start with OTIC over-the-counter products, but before that, we must know or must take an idea about the anatomy of the ear. The ear can be divided into three distinct parts. The first part is called outer ear or external ear. Then the middle ear, and the last part is called inner ear. The middle ear is responsible for transmitting the sound by vibration to the ossicle, and the inner ear is responsible for maintaining the balance of the body. Now we will start with the common ear disorder, which is the most important part in this session. We must know the common ear disorders and how to deal with them. How to deal if we can dispense a medication or refer to the physician or medical provider. What is the common ear disorders? We have here 7 ear disorders. We will talk about them. The first one is an excessive impacted cerumen, then vertigo, tinnitus, external otitis, water-clogged ear, furnicles, and otitis media. We will know each one and which one of them have an OTC medication and which one we must refer to the physician. Now we will start with the first common ear disorder, which is called excessive impacted cerumen, or what we call earwax. How can we deal with this disorder, and what is the medication that can be dispensed, and what is the question in the exam? How can they ask in the exam about this part? That's what we will see now in this slide. The earwax is normally present in our ear for some functions like lubrication, like repelling water, like resistance of infection, because the earwax pH is about from 4 to 5, it's acidic pH, and also for trapping dust and foreign objects. But if the earwax is excessive or impacted, it will cause some symptoms like earache, itching, reflex cough, dizziness, vertigo, tinnitus, and also may cause compromised hearing. So we we need to remove this excessive earwax from the ear by using of some products, but the only FDA approval product called carbamide peroxide 6.5% in anhydrous glycerin, and there is some instructions for the use of these products. First one is the age of the patient. It must be over 12 years old, and you can instill 5 to 10 drops into the ear. This is the second instruction. The applicator tip should not be inserted into the ear canal. Also, the patient should keep the head tilted to the side or insert cotton for several minutes to increase contact time with the cerumen. And this process can be repeated twice daily for up to 4 days. While the patient or children under 12 years old with suspected cerumen infection, they must go to physician or consult medical provider. This is the first product, which is carbamide peroxide. Some other products can be used but not approved by FDA, like olive oil. This is for softening the earwax. Mineral oil, docosate sodium, which can be used also as a stool softener for constipation. We can use also hydrogen peroxide, which is also as antibacterial product, have some antibacterial properties. And the last product can be used, which is ear candle. The second condition that we'll talk about is vertigo. The meaning of vertigo is the losing of an equilibrium, which one might describe a room as spinning. The patient here feels the room is spinning. There may be an involvement of autonomic system, especially if the vertigo is severe and producing dizziness, pallor, sweating, and nausea. In this condition, we must refer the patient to the medical provider. We don't have an OTC product for this condition. The third condition is tinnitus. Tinnitus here have linked to some variety of causes or other conditions like Meniere's disease, headache injuries, otitis media, syphilis, temporomandibular joint dysfunction, and certain medication. Some medication may cause tinnitus. We must know very well those medications, like salicylates, non-steroidal anti-inflammatory drugs, NSAIDs, aminoglycosides, loop diuretics, especially furosemide, and some chemotherapeutic agents. All those agents, we must know them very well that they may cause tinnitus. Also, tinnitus here, like vertigo, we must refer the patient to the medical advisor or medical provider. The fourth condition, which is external otitis. From this name, we can expect the condition, which is related to an inflammation, or especially bacterial or fungal inflammation or infection. It is an inflammation of external auditory canal secondary to bacterial or fungal infection. Here we must know the infection or the bacterial infection or the predominant microorganism that is isolated from the patient, especially with a swimmer's ear. The organisms are Pseudomonas aeruginosa and Staphylococcus aureus. The symptoms here, there is an initial symptoms including itching, sensation of pressure and fullness of the ear, followed by pain, and there may be some otic discharges and possible decrease in hearing. The pain may become quite intense, especially if their outer ear is touched. If the patient outer ear is touched, he will feel a very painful sensation. This pain may generate also by the movement of jaw and showing. What about the treatment of external otitis? In this condition, there may be involvement of bacterial or fungal infection. If there is an involvement of bacterial only or bacterial origin, the treatment here or the prescription here will be with antibiotic and corticosteroid. And if the involvement is of fungal infection, the only option we have is antibiotic. The patient must discontinue the swimming, and any condition will make a trauma for the ear, for the external ear. The antibiotic that used here is an antibiotic drops, but if the condition is unresponsive to these drops, oral antibiotics are necessary. The external otitis should not be self-treated, and this condition, like vertigo, like tinnitus, we should refer to a medical provider. The next condition, number 5, is water-clogged ear. Here in water-clogged ear, we have OTC products approved by FDA, which called isopropyl alcohol 95% in anhydrous glycerin 5%. This medication is approved for the patient over 12 years old. And you can make a home solution 50-50 isopropyl alcohol and white vinegar. You can mix isopropyl alcohol and white vinegar 50% of each. But there is a caution must be taken not to recommend self-treatment for water-clogged ear. This condition not be self-treated because it may attribute an infection, because there is a water in the inside the ear. It's a suitable medium for growing of infection, so it must be treated. The next condition is called furnicles or boils. Furnicles or boils are small abscess surrounding the base of hair follicle in the outer portion of the external ear canal. The causative organism is Staphylococcus aureus. Also, furnicles must be referred to a medical provider or physician. And the last condition is otitis media, which is most famous condition that we face in our practitioners. Otitis media is the inflammation of the middle ear. There is an involvement of bacterial infection, and the patient between 3 months of age to 3 years. Some symptoms of otitis media are famous, like the fluid discharge from the ear, and also ear pain. Here also the patient should be referred to the medical provider. To summarize what we said in the common ear conditions or common ear disorders, there is only 2 disorders we can dispense an OTC product: the water clogged ear and earwax. We must know the products very well, and the FDA approved products, and instructions for those products. All of those information we must know very well. Let us start with some questions.
1. Which of the following non-prescription products is approved by the U.S. Food and Drug Administration, FDA, for treatment of impacted cerumen? A. Olive oil. B. Carbamide peroxide. C. Isopropyl alcohol 95% in anhydrous glycerin. D. Docusate sodium. The answer is B. 2. Which of the following otic conditions can be treated with a non-prescription agent? A. Vertigo. B. Tinnitus. C. External otitis. D. Water-clogged ear. The answer is D. 3. Which of the following conditions is appropriate for the use of isopropyl alcohol 95% in anhydrous glycerin? A. Treatment of impacted cerumen. B. Treatment of water-clogged ears. C. Prevention of external otitis. D. Treatment of external otitis. The answer is B. 4. All of the following are true regarding carbamide peroxide except which one? A. Carbamide peroxide softens earwax by the foaming action produced when oxygen is released. B. Carbamide peroxide is safe for pharmacist recommendation in patients age 6 years and older. C. Appropriate dosing for carbamide peroxide is 5 to 10 drops in the ear 2 times daily. D. Carbamide peroxide should be used for a maximum of 4 days unless otherwise directed. The answer is B. 5. All of the following are true regarding external otitis except which one? A. Initial treatment for external otitis is an oral antibiotic and corticosteroid. B. Symptoms of external otitis include otic itching, pressure and fullness in the ear, pain, and otic discharge. C. Mechanical trauma to the ear with cotton-tipped applicators can contribute to increased susceptibility to external otitis. D. External otitis is also referred to as swimmer's ear. The answer is A. 6. Which of the following is an appropriate counseling tip for administration of otic drops? A. Pull the earlobe up and back to straighten the ear canal for children. B. Pull the earlobe down and back to straighten the ear canal for adults. C. Fill the otic syringe with hot water. D. If cotton is used, it should not be left in the ear for longer than 1 hr. The answer is D.
For more videos and for total course, please contact us on the following email and WhatsApp number and the Facebook link. Thank you.